I have often noticed that the examination room can be a place of great anxiety for many women. It is a quiet space where you might feel vulnerable, and naturally that leads to a lot of questions, some serious, and some that people feel a bit shy or even embarrassed to ask. I have seen thousands of patients, and if there is one thing I have learned, it's that there is no such thing as a silly question when it comes to your health. Whether it is a concern about a complex diagnosis or a small awkward moment during a checkup, my role is to listen and explain things calmly. Today, I want to take some time to address those curiosities you've shared with me, the kind of things that often go unsaid during a short appointment, because time is always so limited. One of the most frequent things patients worry about is the possibility of an accidental slip of gas or flatulence during a physical exam. I want to tell you right now, as someone who sits in this physician's chair every day, please do not let this worry you. From a biological perspective, this is a completely natural and often uncontrollable process. Inside our bodies, the digestive system is constantly working, and air can become trapped in the intestines. When you are on the examination table, we are often asking you to relax your muscles, or we are performing maneuvers that apply gentle pressure to the pelvic area. This physical shift can easily cause air to escape. Furthermore, there are specific times in a woman's life when this is even more common. For instance, after childbirth, the pelvic floor muscles, which act like a supportive hammock for your internal organs, undergo significant stretching and stress. If you had an epidural during labor, those nerves were temporarily numbed, and it takes time for the full command and control of those muscles to return. It is a normal part of the healing process. In my clinic, if this happens, we treat it with the professional respect it deserves. Sometimes, if the patient is feeling relaxed and we have a good rapport, we might share a lighthearted laugh to break the tension. But if I sense a patient is embarrassed, I simply move forward without a word. My priority is your comfort, not a perfectly silent room. There is also a deeper, more sensitive side to this that I see in my older patients. As we age, the tissues and sphincters that manage our bodily functions can naturally lose some of their elasticity and strength. This is an invisible stage of aging. It doesn't happen overnight, but quietly over the years. I often see wonderful, elegant women who have taken meticulous care of themselves their whole lives, and they feel a deep sense of sadness or shame when they realize they can no longer control these functions as they once did. In those moments, I am not just your doctor, I am your advocate. I explain to them that this isn't a failure of their character. It is simply a change in their biology that requires patience and understanding. Another topic that comes up quite often is the concern about hygiene before a visit. I always tell my patients that a basic level of cleanliness is appreciated, much like you would brush your teeth before seeing a dentist. It is a matter of mutual respect in a professional setting. However, I also understand that life happens. Perhaps you are coming straight from a long shift at work or an emergency has cropped up. As doctors, we are trained to be professional regardless of the circumstances. We focus on the clinical task at hand. Interestingly, the sense of smell is actually a diagnostic tool for us. In my practice, a specific odor can sometimes tell me more than a laboratory test could in that moment. There is a condition called bacterial vaginosis, or what we sometimes call amine colpitis. It has a very distinct fishy scent caused by a shift in the delicate balance of the vaginal flora. This isn't a matter of poor hygiene. It is a biological imbalance where good bacteria are outnumbered by others. It is a very common issue that we see and treat regularly. So while you might feel self-conscious, that scent is often a signal to me that your body is asking for a little help to get back into balance. I've also been asked about what happens if something is left behind during an exam, such as a tampon or even a foreign object. You would be surprised how often this happens. In the emergency room, I have seen many cases where a tampon was simply forgotten or pushed too far back during intimacy, reaching a space where it is difficult for the individual to retrieve it. This is actually a health priority because leaving a foreign object in the body for too long can lead to infections or more serious complications like toxic shock syndrome. It may feel awkward to come in for this, but please believe me when I say we have seen it all. From forgotten tampons to more unusual objects used in private moments. My only concern is removing the object safely and ensuring there is no lasting irritation or infection to the delicate internal tissues. Speaking of internal tissues, the body is a remarkably resilient but sensitive system. Everything is connected. A small infection or an overlooked issue in one area can lead to discomfort, discharge, or even pelvic pain that affects your entire day. My goal is to help you understand these connections so that you feel empowered, not embarrassed, when you walk into a clinic. We are here to support the natural rhythms of your body through every stage of life. One question that I hear quite frequently, often with a bit of hesitation in the voice, is, "Doctor, what should I do if my period starts right before my appointment?" Many women feel they need to cancel or apologize, as if their natural cycle is an inconvenience to the medical process. I want to clear this up once and for all. The menstrual cycle is a fundamental part of being a woman, and in this office, it is never viewed as something messy or wrong. Biologically speaking, we are very accustomed to the presence of blood. Think about it. Every gynecologist has spent a significant portion of their career in a delivery room. During childbirth, there is a natural and necessary amount of blood, followed by the lochia, or postpartum discharge that continues for weeks. We are trained to look past the blood to see the underlying health of the organs. While it is true that for certain specific procedures, like a detailed look at the cervix or a hysteroscopy for fertility diagnostics, a heavy flow might obscure our view. For a routine checkup, it is rarely an issue. Your body is doing what it is designed to do, and we can still perform most examinations and collect the information we need. Sometimes, patients worry about more than just the physical exam. They worry about the social dynamics, like an overprotective or jealous partner. In my years of practice, I have seen all types of relationships. Occasionally, a partner may feel uneasy about a male doctor performing these sensitive exams. Usually, if a man knows he struggles with these feelings, he simply chooses to stay in the waiting room. We live in an era of empowerment where a woman's health is her own priority, and my focus remains strictly on providing the best clinical care for my patient. I handle these situations with a calm, professional boundary, ensuring the patient feels safe and that the medical necessity of the exam is respected. There are also those moments in the clinic that are truly life-changing, moments that stay with both the doctor and the patient forever. I'm talking about the unsuspected pregnancy. It may sound like something out of a movie, but repressed pregnancy is a real biological and psychological phenomenon. I have had patients walk into my office with what they thought was simple abdominal pain or bloating, only for me to turn the ultrasound screen and show them a fully formed moving child. In one particular case, a couple came in quite relaxed, just looking for a reason for some discomfort. When I showed them the image of the baby, the atmosphere changed instantly. The mother turned bright red with shock, and the father was completely speechless. In those moments, I have to be very careful. Biology tells us what the age of the fetus, the health of the heartbeat, but the how and the who are private matters for the couple to navigate. I provide the medical facts, ensure the baby is healthy, and then I give the couple the space and time they need to process the news. It is a delicate balance of being a medical expert and a supportive human being. Sometimes these pregnancies aren't discovered until the very last moment, when the woman is actually in labor. This often involves a deep, invisible psychological defense mechanism where the mind protects itself from a reality it isn't ready to face. When a woman arrives at the hospital in pain, not knowing she's about to give birth, our role shifts. We must quickly assess the background, involve social services if necessary, and provide a calm, steady hand to guide her through the most intense physical experience of her life. We don't judge. We simply act to ensure two lives are brought safely into the world. This brings me to one of the most difficult parts of my job, delivering a serious or painful diagnosis. This is something they don't, and perhaps can't, fully teach you in medical school. It requires a deep sense of empathy and the ability to read the person sitting across from you. Some patients want every single clinical detail and statistic, while others need a moment of silence to let the words sink in. In my practice, I have learned that no matter how busy the clinic is, no matter if the world is ending outside that door, you never leave a patient alone in their grief. You take the time. You listen. You listen to your own humanity. Because at the end of the day, a doctor isn't just a scientist. We are caretakers of people's lives and their most intimate fears. Whether this news is a surprise pregnancy or a difficult illness, the connection between the doctor and the patient is what helps the healing process begin. Another topic that I see being discussed quite frequently, and it actually surprises me how much concern it causes, is the question of weight. Many women who carry extra weight feel a sense of hesitation or even fear about visiting the gynecologist. I want to be very clear with you. As a doctor, I see you as a person, not a number on a scale. In my many years of practice, I have treated patients of all shapes and sizes. When a woman who is significantly overweight comes into my office, she is usually very aware of her body. She doesn't need me to point out her size. She needs me to provide high-quality medical care. Biologically, excess weight can make certain things a bit more challenging for us, but it is nothing we cannot handle together. For example, during a pregnancy ultrasound, a thicker layer of adipose tissue on the abdomen can act as a barrier for the sound waves, making the image of the baby a bit fuzzy or limited. In these cases, I simply explain the technical limitation. Sometimes I might need the patient to help by gently holding back a fold of skins so I can get the probe closer to the pelvic bone where the baby's head usually rests. We work as a team. I don't spend our short time together lecturing you on lifestyle choices you already understand. My job in the clinic is to ensure your reproductive health is stable and that your pregnancy, if you are expecting, is monitored safely. We treat every woman with the same standard of care, ensuring that screenings and checkups are thorough. It is a normal part of my daily routine, and it should feel normal for you too. I also get asked occasionally about the more human side of the doctor-patient relationship. Specifically, what happens if a patient develops a crush or feelings for her doctor? To be perfectly honest with you, I am usually quite oblivious to these things. When I am in the exam room, my mind is 100% focused on the clinical signs, the history, and the diagnosis. I am looking at the health of your tissues and the rhythm of your symptoms. I've had friends tell me later that a patient was flirting, and I truly didn't notice because I was so concentrated on my professional duty. And that is exactly how it should be. It allows me to remain a steady, objective professional. If a patient ever were to express such feelings, I would handle it with the same calm kindness I use for everything else, maintaining a clear boundary while ensuring she still receives the medical respect she deserves. On the other hand, people sometimes ask about the extreme side of this. What if a patient wants more than just a medical exam? In all my years of practice, I have never actually experienced this. The setting of a gynecological clinic is so clinical and focused on health that the idea of it being anything else is quite foreign to the reality of the work. If such a situation were to arise, I would simply pause the exam, ask the patient to get dressed, and explain that our professional relationship is centered strictly on her health and well-being. One of the most common things people find slightly humorous but also curious is a phrase almost every gynecologist says, "Could you please slide down a little bit further toward the edge of the table?" You might wonder if this is just a habit we learn in school, and the answer is yes, but for a very important biological and mechanical reason. When we perform an internal examination or an ultrasound, we often need to use instruments that require a specific downward angle. If you are sitting too far back on the chair, the cushioning of the seat itself blocks the movement of the instrument. To see up into the cervix or to get a clear view of the uterus with an ultrasound probe, we often have to tilt the handle down. By sliding right to the very edge of the seat, you are giving us the necessary clearance to move at the correct angle. It's not just a cliche. It's the only way to ensure the exam is as quick and accurate as possible. It's a small adjustment that makes a big difference in the quality of the information we can gather about your health. Sometimes patients share stories with me about unusual accidents or what they might call intimacy mishaps. I've been asked what the strangest thing I've ever found during an exam is. While most visits are very routine, there are rare occasions in the emergency room where we see the results of nature-based experiments or accidents. I once treated a young woman who had used pieces of tree bark and branches internally. It was quite a unique situation that required very careful removal to prevent tearing or infection. I always tell my patients, the body is wonderful, but it is also delicate. If you are using toys or aids, please stick to professional, body-safe materials. Using organic or sharp-edged items from nature can introduce bacteria and cause microtears in the sensitive lining of the vaginal wall, leading to serious complications. In a similar vein, I've often been asked about how we handle patients who might be under the influence, such as a pregnant woman arriving at the clinic intoxicated. While I personally haven't encountered this specific scenario often, it would be a situation handled with extreme care and immediate medical intervention. Our priority is always the safety of the developing baby and the health of the mother. We don't look at these situations with judgment, but rather with a focus on the biological impact of substances on the placenta and the baby's development, ensuring we provide the right support for both. People also wonder if doctors ever get grossed out. In my many years of practice, I have seen almost everything the human body can experience. From heavy bleeding to infections and the intense physical reality of birth, nothing shocks a seasoned physician. We see the human body as a masterpiece of biological engineering, even when it is struggling or messy. One of the liveliest experiences in my career involves the cultural side of medicine. In some cultures, birth is a massive family event. I have seen situations where 10 or 12 family members try to squeeze into the delivery room, cheering and shouting like they are at a sporting match. While our hospital rules usually limit visitors to 2 people to keep the environment sterile and calm, seeing that level of communal joy and support is actually quite beautiful. It's a reminder that birth isn't just a medical procedure, it's a milestone for an entire community. Looking back, I still remember the very first time I performed a pelvic exam when I was a young medical student. I was incredibly nervous. I remember being so focused on not causing the patient any discomfort that I was probably sweating through my coat. It takes time to develop the clinical touch where your hands and eyes work together seamlessly to understand what the body is telling you. We all start somewhere, and that early nervousness is what eventually grows into the calm, steady experience I bring to my patients today. My goal in sharing these stories and explanations is to pull back the curtain on the doctor's office. I want you to feel that you can walk into your next appointment with confidence, knowing that your body, in all its natural functions, surprises and changes, is something we respect and understand deeply. Whether you have questions about a symptom or just a curious thought about how things work, remember that your health journey is a partnership. We are here to listen, to explain, and to care for you through every stage of your life. If this video has been full use to you, please give it a like, subscribe to the channel, and turn on the notification bell. Help me reach 50,000 subscribers so that more people can receive this information.